Have you ever walked into a room and caught a whiff of something unpleasant, only to realize with horror that it might be coming from you? Or maybe you've noticed a loved one, your mother, grandmother, or dear friend, has developed an odor that wasn't there before, and you're not sure how to address it delicately. This isn't about vanity or embarrassment, it's about dignity, health, and quality of life. What many don't realize is that unexpected body odor in older women often signals underlying issues that are completely fixable once you know what to look for. Today, I'm sharing 6 silent mistakes that doctors see repeatedly in their older female patients, mistakes that can cause persistent odor but are easily corrected. By the end of this video, you'll know exactly what these mistakes are and, more importantly, how to fix them naturally and effectively. If you're here because you care about maintaining dignity and health as you age, or you want to help a loved one, comment, "I'm here," below. And don't forget to subscribe to Elderly Health Central for more essential health insights that can make a real difference in your golden years. Let me start by telling you about Lisa, a vibrant 68-year-old who prided herself on her cleanliness. She'd used the same soap and routine for 30 years. But suddenly, family members started noticing an odor. Lisa was devastated. She was doing everything the same way she always had. Here's what Lisa didn't know, and this is our first major mistake: sticking to the same hygiene routine from decades ago. As we age, our skin becomes thinner and drier, our hormone levels change dramatically, and our body's natural oils shift. The gentle soap that worked perfectly at 40 may not be effective enough at 70. Additionally, decreased mobility can make it harder to reach certain areas thoroughly. Many women think, if it worked before, it should work now, but our bodies have different needs as we age. Some even reduce bathing frequency thinking their skin is too delicate, which actually makes the problem worse. The solution for Lisa, and for many of you, is to switch to antibacterial soap specifically designed for sensitive, aging skin. Consider using cleansing wipes for daily touch-ups in hard-to-reach areas. If mobility is an issue, invest in long-handled brushes or ask for help. There's no shame in ensuring proper hygiene. But changing your soap won't help if there's another invisible culprit working against you. Let me tell you about Sandra, who started taking new medications for her blood pressure and diabetes. Within months, she noticed a metallic, unusual smell that seemed to follow her everywhere. She was too embarrassed to mention it to her doctor, thinking it was just getting older. This brings us to our second critical mistake: ignoring how medications affect body chemistry. Many common medications, including blood pressure drugs, antidepressants, and diabetes medications, can alter your body's natural chemistry. They can change how you sweat, affect your saliva production, and even alter your body's natural bacterial balance. Some medications also cause increased sweating or changes in body temperature regulation. Most women suffer in silence, thinking this is just an unavoidable side effect they have to live with. Others stop taking important medications out of embarrassment, which is dangerous. Here's what Sandra should have done, and what you should do: always discuss any changes in body odor with your doctor. They can often adjust dosages, timing, or switch to alternatives. Stay extra hydrated when on these medications, and consider probiotic supplements to maintain healthy bacterial balance. Never stop medications without medical supervision. Speaking of things we put on our bodies, there's another mistake that's hiding in your closet right now. Carol loved her polyester blouses and had a closet full of them. She couldn't understand why she felt stuffy and noticed odors clinging to her clothes, even right after washing them. The problem wasn't her, it was her wardrobe. This is our third mistake: wearing the wrong fabrics and ill-fitting clothes. Synthetic fabrics like polyester trap moisture and bacteria against the skin, creating the perfect environment for odor-causing bacteria to thrive. As we age and our body temperature regulation changes, we may sweat differently. Additionally, clothes that are too tight restrict airflow, while clothes that are too loose can create friction and irritation. Many women choose polyester because it's easy care and affordable, not realizing it's working against them. Others were the same size they've worn for years, not accounting for how body shape naturally changes with age. The solution is to invest in natural, breathable fabrics like cotton, linen, and moisture-wicking blends. Ensure proper fit. Clothes should allow air circulation without being baggy. Wash clothes in hot water when possible and consider adding white vinegar to eliminate bacterial buildup in fabrics. But even with the right clothes and hygiene routine, there's an internal factor many women overlook. Diane kept masking what she thought was just old lady smell with perfumes and air fresheners. What she didn't realize was that her undiagnosed thyroid condition and early-stage kidney issues were the real culprits behind the persistent odor. This is our fourth mistake, not addressing underlying medical conditions. Several medical conditions common in older women can cause distinctive odors. Diabetes can create a sweet or fruity smell, kidney problems can cause an ammonia-like odor, liver issues can create a musty smell, and thyroid disorders can affect sweating and body temperature. Urinary tract infections, which are more common in older women, can also cause persistent odors. Many women assume odor changes are just part of aging and don't mention them to healthcare providers. Others try to mask the smell instead of addressing the root cause, potentially missing early warning signs of serious conditions. Keep a symptom diary noting when odors are strongest and any accompanying symptoms. Be honest with your doctor about changes in body odor. They're medical professionals and this information is crucial for diagnosis. Don't self-diagnose, but do advocate for thorough testing if odors persist despite good hygiene. Now, let's talk about something that affects your body from the inside out, and it's probably sitting in your kitchen right now. Helen thought she was eating healthily with her daily coffee, occasional glass of water, and regular meals. But she couldn't shake a persistent, stale odor. The problem wasn't what she was eating, it was what she wasn't drinking and how her food choices were affecting her body's natural detoxification. This is our fifth mistake: poor hydration and dietary choices. Dehydration concentrates waste products in urine and sweat, making them smell stronger. As we age, our sense of thirst diminishes, so many older women are chronically dehydrated. Additionally, foods high in sulfur like garlic and onions, excessive caffeine, alcohol, and processed foods can all contribute to body odor. Poor digestion, common with age, can also cause internal odors to manifest externally. Many women reduce water intake to avoid frequent bathroom trips, especially if they have mobility issues. Others don't realize that their favorite foods might be contributing to the problem, or they assume that 1 cup of coffee equals 1 cup of water for hydration. Aim for 6 to 8 glasses of water daily, sipping throughout the day rather than drinking large amounts at once. Reduce sulfur-rich foods if you notice a correlation with odor. Add natural detoxifiers like lemon water, herbal teas, and fresh fruits. Consider digestive enzymes if you have trouble processing foods. The final mistake might surprise you because it's not about your body at all, it's about your environment. Mary was meticulous about her personal hygiene, but visitors kept commenting about an unpleasant smell. The issue wasn't Mary, it was her environment. Her laundry wasn't drying properly, her bedroom had poor ventilation, and odors from her living space were clinging to her clothes and hair. This is our sixth and final mistake: neglecting environmental factors and living spaces. Our living environment significantly impact how we smell. Poor ventilation allows odors to build up and cling to fabrics and hair. Damp conditions encourage mold and mildew growth. Old or improperly cleaned laundry machines can harbor bacteria. Even cooking odors can penetrate clothing and hair more easily as we age. Many women focus solely on personal hygiene and don't consider how their environment affects their scent. Others may have decreased sense of smell and not notice environmental odors that are obvious to visitors. Ensure good ventilation in all living spaces, especially bedrooms and bathrooms. Clean washing machines monthly with hot water and vinegar. Use exhaust fans while cooking. Wash bedding and curtains regularly in hot water. Consider air purifiers in main living areas. I know this topic can feel overwhelming or even embarrassing. The truth is, dealing with unexpected body odor can affect your confidence, your social connections, and your overall quality of life. You might avoid social situations, feel self-conscious around family, or worry that others are talking about you behind your back. But here's what I want you to understand. These 6 mistakes are exactly that, mistakes. They're not character flaws, they're not signs of failure, and they're certainly not inevitable parts of aging. They're simply problems with solutions. Knowledge is power, and now you have the power to take control. If you recognize yourself or a loved one in any of these scenarios, I encourage you to start with just one small change this week. Maybe it's switching to a different soap, scheduling a doctor's appointment, or simply drinking an extra glass of water each day. Small steps create big changes. Remember, aging gracefully isn't about being perfect, it's about being informed and proactive. You deserve to feel confident and comfortable in your own skin at every age. These solutions aren't just about eliminating odor, they're about reclaiming your confidence and living your best life. Let's quickly recap those 6 silent mistakes. Outdated hygiene routines, ignoring medication effects, wrong fabric choices, unaddressed medical conditions, poor hydration and diet, and environmental factors. If any of these resonated with you, you now know where to start making positive changes. I'd love to hear from you in the comments. Have you or a loved one experienced any of these issues? Which mistake surprised you the most? And if you found solutions that work, please share them. Your experience could help another woman feel more confident and comfortable. If this video helped you understand something you've been struggling with, please give it a thumbs up and consider subscribing to Elderly Health Central. We're here to provide practical, dignified health information that makes a real difference in your daily life. Thank you for watching and for caring enough about your health and dignity to seek out this information. Remember, you're worth the effort it takes to feel your best. I'll see you in the next video, where we'll continue supporting each other on this journey of healthy, confident aging.